Doctor, in general, if we look at it, how the global cancer landscape is and what is missing in India? What is that we are lacking in India?
We are not lagging behind any of the global institutions as far as the cancer care is concerned. And even for the appointment of a cancer specialist is very easy, especially in Indian metropolitan cities. So in a patient, suppose if you go into a tier 2 or tier 3 cities, there it is a bit difficult. But in a tier 1, it's there. I think they can have an appointment of a super specialist as good as in the West. So we have all the facilities as far as the diagnosis is concerned. We have all the facilities as far as the treatment is concerned, and as well as some newer advances in terms of clinical trials. We have already started in India. So there is one probably slight lacuna in the clinical trials. Otherwise, we are on par with the Western population.
Right. So since India, if we look at it, it being a developing country, our country and neighboring countries, we are witnessing a kind of rapid increase in the number of cancer incidences and mortality rates. In simpler terms, if you have to talk to a layman who doesn't know anything about medical terms, क्या समझाएंगे आप लोगों को कि कैसे इस भयानक बीमारी से बचकर रह सकते हैं?
So मेरा सजेशन यही है, जहाँ पे भी हमारे पास एक स्क्रीनिंग गाइडलाइंस है, सो स्क्रीनिंग गाइडलाइंस को अधेर करें, क्योंकि बहुत सारे जो कैंसर्स हैं उसमें हम स्क्रीन करके अर्ली स्टेज पे डिटेक्ट करके उनको क्योर किया जा सकता है. और बहुत सारे हमारे ये बोलते हैं ये कैंसर है, पूरे कर्म है, ये दैट इज नॉट द राइट थिंग राइट टू थिंक ऑन टर्म्स ऑफ. सो आजकल इवन स्टेज 4 डिजीज में भी बहुत सारे एडवांसेस है जिनको भी diagnosed किया हो, so diagnosed हो गया, so already it has been diagnosed, you should come out and then probably reveal it and show it to a specialist, so that with the current context of knowledge how to do best in that particular patient, that particular oncologist will be knowing. So ये मेरा मैसेज है. जब ब्रेस्ट कैंसर के लिए जिनका भी 40 years plus हो, मैमोग्राफी 1 to 2 years में करा लीजिए, and for cervical cancer एक simple pap smear will give us an answer कि जो स्क्रीनिंग से हमें डिटेक्ट हो गया अर्ली स्टेज एंड वी कैन क्योर देम. एंड इन कोलोन कैंसर जो कोलोनोस्कोपी या फीकल अकल ब्लड टेस्ट होते हैं जो 50+ years होंगे, या पीएसए जो प्रोस्टेट कैंसर की जो स्क्रीनिंग होती है, तो ये मिनिमल चीजें हैं जो करने से हमें वी कैन डिटेक्ट दिस अर्ली स्टेज कैंसर एंड क्योर लॉट ऑफ द पेशेंट्स.
But can we prevent this disease? Can we keep it at bay from our lives? What changes can we bring into our lives to?
So lifestyle changes are not different from the other diseases that we follow, be it a cardiovascular or any other diseases. So the lifestyle modifications remains same irrespective of whatever disease they have. So the exercise, daily exercise, and the fruits, the 5 servings of fruits every day, and then cutting on the junk food. So all that are as important as other diseases as well.
Right. So during this time, if a person who is already a cancer patient and finds the symptom of COVID-19, is he at more risk?
Absolutely. So somebody who acquires a COVID-19 and has a cancer, so more so somebody who is on chemotherapy, whose counts are decreasing, so they are at a very high risk of mortality. So as we know, the COVID-19 definitely causes the immunity which is suppressed, and as well as lung infection. Somebody who's having a lung cancer are even more riskier because already lung is compromised. So definitely cancer patients are immunocompromised, and more so whoever is on chemotherapy, and if they acquire COVID, they have definitely have a high risk of mortality.
Right. So Doctor, one concern is, since you've been in this field for so long, cancer is a disease which not only kills you physically, it not only breaks you mentally, but also financially. Financial concern is one of the major concerns. Why is this treatment so expensive? How can we make it affordable?
One thing, it's like, again, I'm telling you, it should be from both the ends. You have to educate as a media to all the patients or all the guys to get self-insurance done. The health insurance is very, very important. That's the first and foremost thing which is very important. Then comes the costlier steps. So the government has done a great job in capping the medications cost. And thanks to our Indian companies, where they have got a lot of generic drugs, and that generic drugs cost almost one tenth of what the original is. So that is a commendable job as far as India is concerned. So we are now manufacturing generic drugs in the Indian companies, and they're exporting it outside, even to US. So that's a great news. So in that context, the cost is coming down. And when it comes to a original the molecule research molecule, there will be patency for some years. So because they've done a research of almost many years, because if you know a phase 3 randomized trial take a lot of time and there a lot of expenditure. So that is why that cost is. And if you probably that is not required for each and everyone. That is only a portion of the people. Large majority, the cost is cut down if you have insurance, which makes us very for any oncologist. Now it makes their job easier. And the second thing is that thanks to Indian companies, we have cut down the cost. Yes.
हमसे जुड़े रहने के लिए सब्सक्राइब करें यूट्यूब पर, फॉलो करें ट्विटर और इंस्टाग्राम पर, लाइक करें फेसबुक पर और ज़्यादा जानकारी के लिए नेशनल खबर की वेबसाइट पर जाएं। आपको टाइप करना होगा सिर्फ नेशनल खबर।